Her Opinion Show, the podcast you didn't know you needed. Real talk, bold truth, her voice, her vision, her rules. Let's get into it.
We are so excited for this show, and especially every time when we talk about the lady parts. Today, we have a special guest with us, Dr. B.
Yes.
The pelvic floor specialist. Is that what you say?
Some people call me pelvic floor specialist.
Okay.
Some people call me pelvic floor PT.
Okay, there you go. I like that one
Physical
better.
therapist.
And I said TT.
Yeah, which is important
And her
too.
TT.
Yes, because that's something we'll talk about on the here later. But one of the things was don't hold your
TT.
Yeah, your TT. Don't
Hey,
hold
there's so
it,
much to talk about. I think for having children, I mean, I had 3 of them, and all naturally, there's a lot that I want to learn. I feel like I should know all of this stuff, but you don't.
You never do.
No,
You never
honestly,
do.
you're not alone.
Okay, how did you even get into this?
Oh, okay. So
Let's start
It
from
all
the
started.
beginning.
Yeah. Well, I've been a PT for PT means physical therapy, not personal trainer. But I've been a PT, for me, that is, but been a PT for 15 years.
Okay.
And in that time frame, I primarily worked in neurological care. So that's like all your stroke rehab, all the, spinal cord injury, all the things that people have that are more debilitating than, or pretty severely debilitating from your day to day. I got into management where I worked before. And then from there, actually all the time, one of my providers, my, what do you call those? Professors, not providers.
Yeah.
Same thing. They provide.
Yeah, they provide
the grade.
Provide the grade.
Yeah.
Anyways, she was basically like, how about going into pelvic PT? Because there's not many of us. We're growing field, we're a growing space in physical therapy. However, there's not a lot of pelvic floor therapists out there. And they were starting a new practice at the university I went to for already established practitioners to kind of extend their knowledge into pelvic health. I took one class in the summer, loved it. And it was like a combination of the two worlds that I love so much, which is neuro and women's health. And it was just like the perfect marriage. And I never looked back. And here I am.
So does insurance cover something like that?
It does. Okay. It does. And one of the good things is there's so many ways that insurance can cover it, but then there's also options in the case that you're looking for something different or you don't have a physical issue that you can actually get the same kind of care. So for instance, the way my practice works at Awareness Pelvic Health, we tend to see people what is considered out of network, right? So we don't necessarily have to be, tied to any specific insurance company or any issue specifically, because pelvic floor therapy is so much more than just a problem. I think there's a lot of it that is preventative, and so we really hyper focus on not just the fixing the problem, but making sure it doesn't happen. And we find that it's like the best in the way we practice.
So you probably see other stuff besides just pelvic situations as a PT, right? You're seeing like groin pulls, things like that, right? And then maybe as a woman, it could tie into something there. Or what I'm saying is my insurance doesn't cover it. Can it cover something else in that area?
Because a lot of people think, oh, it's just such a big problem. I just get surgery for it. And then there's people that can't have surgery, but I think that having something specifically, and you said that it has to do with the mind too.
Oh my gosh, yeah.
So that's something that I never really thought about it.
We got to dive deep. Because we don't know, like we think when you say pelvic PT, doctor, any of those things, we're thinking she's going to tell us the exercises that we need to do. She's going to tell us that our vagina's broken and that
and we only know one exercise that everybody talks about.
But obviously this goes way deeper than all of that. It's so tell us,
like
take us down the rabbit hole of all the things pelvic.
Right. Let's go.
And I know you got some little
I do have some.
We're calling them toys, but they're actually demonstrations.
Toys, models, whatever you want to call them. I think that there's a lot of people that don't look at their vagina. There's a lot of people that don't know how many holes they have. There's a lot of people that don't know that there's muscles that live inside the pelvis that actually do the work of your hips, like your groin muscles that live there. And so a lot of what we do, or what I do in pelvic floor therapy, is education and awareness and connecting what's going on down there to your brain. Like if I ask you to grab your cup and put it to your lips, you can mentally think about what that takes. You know how much load to put in your hand. You know how much pressure to put on your lips. A lot of times when I ask people like, okay, I need you to pull your pelvic floor muscles up, hold it up 2, 3, 4, 5, pull it up a little bit more, take it down. They're like, is it
what
down?
does that mean?
Yeah.
Is it, did I do it? I don't know.
You even
Right.
talking about it, I have no idea. I mean, I'm thinking, is it a Kegel? Is it, what is it? Yeah.
So, I mean, and that's one of the things that's the brain body that we've talked about in the past, because if you don't know what these muscles do, it's hard to make your brain connect to it to do the thing that you're wanting to do to achieve the goal of not peeing anymore, having sex not be painful anymore, pushing a baby out, not having that tailbone pain, releasing your groin better.
Tailbone pain is, I feel like that's a big one.
Yeah.
A lot of people,
depending what age you are.
Yeah. A lot of people have said, well, the reason why you start having that pain is because you had an epidural.
Oh.
You know, so but I'm thinking that has nothing to do one with the other.
It could, but then it also could be things and habits that you have.
Yeah.
Like, because people who haven't had an epidural and have that pain.
And
that's what I'm saying.
Yeah.
Or haven't had a baby and have pain. And they're like, or men that have never had a baby, you know, or that have pain in their testicles, and they're like, what is this pain? Like,
And
I don't understand.
that's a misconception because men have pelvic floors too.
They do.
You know, and that's something that I didn't know until you were coming.
And they're so busy worried about exercises that we're supposed to be doing.
I know. They
and
might
not
need to
doing
do
their
some
own.
too.
Yes.
Yeah.
So men, you need to be doing your own exercises.
Yes.
Yeah.
So I like that you brought this little
Model.
vagina. And as you were showing it to us, like we kind of had a misconception of what the end part of it was.
Yes.
But then you
So I flipped
showed
it
us.
in.
I know.
Which I'm going to stop here
Okay.
because right here is a thing that a lot of people see in there, or when they look down and they're like, oh my gosh, what is happening here?
Yeah.
And that can also be something called prolapse, which happens after somebody has a baby or just uses wrong, you know, the wrong pressure techniques, strategies when pooping, and it can cause a lot of strain and make these tissue move out. But this right here is your cervix. So it's the beginning of where your uterus is.
And that's inside.
Inside.
Yeah.
And so I know at first people were like, oh yeah, it's just the vagina, but this is actually not the vagina.
Yeah.
This is the vagina.
The inside.
The
is
inside.
The inside's the vagina.
We learned that on another episode.
I know.
Exactly. Oh my
Plastic
God.
surgeon.
I know.
We were all vagina because the inside is the vagina, not the outside.
Yeah. And you carried it over. So here we are.
Yeah.
Yeah. And so a lot of times people don't realize, one, the vagina's inside. 2, you don't pee out of your vagina. There's a tube right above it, underneath your clitoris, that pee comes out of. And when people are having issues with like bladder leaks per se, we want to see what these muscles, because we have deep muscles and then we have outer pelvic floor muscles.
Yeah.
And they both matter because they both play a role in kind of allowing poop and pee to come in and out, or out.
Yeah.
when you want it to come out, we don't want anything going in.
Yeah.
One of those going in. And then also like allowing the baby to come out, penis to go in, all the things, toys to go in. And what we do in pelvic floor therapy is make sure that those things are working right. And if they're not, we teach you how to make them work right.
So that's another question. So there's many different exercises you were saying, because you said that if you told us to do something, we probably wouldn't know what that meant or how to do it. So the only logical way that we would think about how that works down there is maybe during sex, and when you're, you know, in
The moment.
Yeah.
the penis is in the vagina.
Yeah.
Yeah.
That you may think to thrust or to
Squeeze.
squeeze.
Yeah.
You know, that's what I'm looking for.
Yeah.
Those things. But when it's not happening, that's like, what? Huh? How? You know, I mean, I can think about squeezing right now, but I don't think I'm doing it right. Like, I don't know if I'm supposed to, what the feeling's supposed to be.
Yeah.
Right?
So
what do you tell these patients?
all right.
What do you tell
Here
us?
we go. Let's do it.
We're the
Act
patient.
like we're
So
hypothetically we're your
imagine
patient.
we just went to Sonic or something to get a shake.
Okay.
And you get that thick straw.
Okay.
And you're about to take a sip. The power that you need to take that suck in that straw, that sip, it's like, and you're pulling it all the way up. That is a motion of pulling up the pelvic floor to do a Kegel.
Okay. Yeah.
Okay. If you had to, right? So you suck in the straw.
Suck it in, girl.
So
right?
are you breathing in and like doing it?
You should actually be breathing out and doing
really?
it. Try it. Here
You can't. That's two different things.
You see? So that's where you know.
Yeah. You don't know what you're doing.
The brain and body is not doing what it needs to do.
Okay.
So if you can't exhale and suck in the straw at the same time, your pelvic floor is doing opposite things.
Okay.
And so as a result, if you're a person that has leaks, I'm not surprised. If you're a person that has difficulty fully emptying your bladder, I'm not surprised. Like you got to go to the bathroom again and again. If you're a person during sex, you're like, that is really painful, I'm not surprised because your pelvic floor muscles are probably doing the opposite thing of what they should be doing. Or
out of shape.
Or you didn't pull them up in time and that's why you're leaking. Or because you held your breath, now you're adding pressure instead of supporting it during the time that you need to.
And I know that, sometimes you have your little bit, and this is a little bit too deep, but you might be sometimes afraid that if you are going to orgasm, that you're going to pee. Like, because it's two different things. But if your pelvic muscles aren't strong, it could happen.
Honestly, squirting isn't a problem. Like, I think
that's another thing.
But is it pee,
that might not
or
be
is it...
Well, that might see. There's out there people think it's not pee, and then there's other ones that are like it's pee. And so, can you medically tell us?
It's
pee, right? Pee. It's got it. Where is it coming? No.
Give us an educational.
What's the word? It can't be anything else but pee, because
it could be pee, and it could also be vaginal discharge. Like,
but to actually squirt.
Yeah, there's just some people that have like if you have really strong pelvic floor muscles, and the female ejaculate happens a little bit more powerful in some people than others, like that could be a thing. And then also squirting is a thing that can happen with any body. And there's a level of like let go almost that happens to some people that allows for squirting to happen. And then there's other people that enjoy the feeling and do more things to kind of encourage it. And then there's other people that are like, I do not like this, and I don't know how to stop it from happening. And I think what all that plays into is what's the problem. Like, I remember once I had a patient that was like, I mean, my partner isn't complaining, but this is terrible. Like, I have to put stuff down in order for me to have sex because it just goes everywhere.
Can't control it. Yeah.
And there's such a taboo that they like it, that everybody likes it.
I think it was a woman who unfortunately had a little problem, and then it became a thing.
Yeah.
And then it got turned up to be like, oh wow, if you're not doing this, you're not cool. And then now here we go, a bunch of women are like, I know.
And now it's happening when you're laughing or dancing at the club.
It's squirting all day.
And that's not what you want.
Yeah, exactly.
Yeah. So we just want to make sure that if it's happening when you're wanting it to, and you know what to do to kind of
control
not have that issue in other situations.
So could you control it? Like, if you are in the middle of it, can you control not squirting?
I honestly don't know.
So we couldn't come to you for that.
I know.
We couldn't come.
I'm not getting anybody to squirt, and I'm not getting anybody to stop squirting.
Okay. Yeah.
But if
you want
like
to,
a
but you
bladder
can.
leak,
I was gonna say you can help
leak.
with if it was like if I came and said I think it's a bladder leakage problem.
Yeah.
Then you could do it that way.
I could address that.
So what would you say to do exercise wise to control that?
To control peeing.
Leaking, the leaking and all of that stuff. So if it were me, let's just say, had 3 kids.
Jen peed on her way here.
Hey, you know what? When I laugh, when I cough, I got to cross my legs.
Okay. So I'm so glad you brought that up because it depends. Because there's some...
Or you need depends.
Or depends.
You don't even need depends. You need to come see me. We can just get rid of the depends altogether.
Hey, I'm not embarrassed to say.
No, I mean, it's a thing that people have. I remember there, even myself, like I'm a pelvic PT, so I can really tell when my body is not doing what it needs to do. And I'm like, holy crap, I cannot control my urine. And I can tell. And it's usually when like, if I've gained weight and I haven't been exercising and I
That's true.
have been like, you know, and let's just say like I have a glass of wine or something and I'm just out and about and I'm a little loose. It can happen to me.
Loosey-goosey.
Right?
Loosey-goosey.
Right? And so from that standpoint, it would all depend on your situation. So you talk about laughing, coughing, and you have to cross your legs. Sneezing, gotta cross your legs.
Jen laughs a lot on the show, so we have to be checking her.
So it's only, you know what? It's only when I'm standing.
When you're laughing.
Oh.
So do you see that?
We need to get a shawl.
Remember how I told you have to breathe out and squeeze out?
Okay.
Do you see what I mean?
Yeah, but I got to really think about it.
I guess I kind of.
Hey, you know what's funny is that I'll be looking at somebody and they'll know what I'm doing.
Like you do it. Yeah.
That I'm doing it. But it's mostly when I'm standing up. Yeah. Like if I'm sitting down, I'm fine. It's just when I'm standing up.
I believe it.
I have to go and like be like, hold on,
you gotta go.
Or I'm crossing.
And
if
a lot
I'm
of
gonna
my
sneeze,
friends that have had multiple kids always have that problem. They're always complaining about that, or they've had surgery for it, or something like that. And I just had one, and I had them really young, so I never experienced that. But that's not the only way, because when you get older, I feel like now it's more of a control thing. Yeah. So when you get older, then you're like, oh wait, is this what they were talking about that whole time? Like I've had those moments where it's like, oh, I'm laughing so hard, and then oh shit, you made me pee a little, you know? And you're like, but that I think comes maybe from, so Kegel balls, can you use those to help?
Yeah,
with the clench?
I mean, you can. I always here's my thoughts on like devices when you don't know your baseline. I think sometimes like for anybody that's just like, I generally leak. I don't have pain with sex. I can if I have an urge, I have a hard time holding it. And if I'm sneezing and laughing and coughing, I have a hard time controlling it. Let's just talk about the urge and then the controlling it when I have. Those are two different issues. So like the one where I have an urge and I can't control it, that could be like a true weakness of your pelvic floor muscles. While the other one where it's like sneezing, laughing, coughing, ha ha ha, that could be a coordination issue.
So if you're not using it down there, maybe it's been a minute. Could that be a weakness?
No,
okay.
not necessarily.
As long as you're exercising.
Yeah, because everybody has, especially if you're exercising, it's less likely because of the fact that your core muscles, your glutes, all of those play a role in supporting your pelvic floor. And so if you're exercising, it doesn't necessarily mean you have a tight pelvic floor, but if you can't blow a straw, if you can't blow and suck the straw in, that already tells me it's a coordination issue. That already tells me that there's definitely a coordination issue there, because if I could teach you when to do it, you likely will immediately. I've had that. Where a person came to see me 2-3 times. They're like, every time I sneeze, I'm live, I pee. And all I did was say, okay, I'm squeeze my finger. And by squeeze my finger, my hand is in your vagina and you're going to squeeze my finger. And then I'm going to ask you to let my finger go. And then I'm going to ask you to cough. And I'm going to see what you do. And then I'm going to be like, no, that's not the time. Do it now. And then cough. Okay. Do you feel that? Okay, great. You felt that? Great. That's what you need to do.
So
when you're
we can put a finger in our vagina and do the same thing.
Yeah, you could try.
I mean, to see if we're moving.
You can. You
know
can
what
squeeze
I mean?
your finger. Yeah, you could totally squeeze your finger and see what happens.
No, hey, if there's
your
open
finger
space,
don't come out,
you don't feel nothing.
You have a strong.
Oh my God.
Open space is like, dang, she's wide open.
Oh no.
So talking about exercises, so we took it upon ourselves to order something.
Okay.
And tell us if this little device helps with anything.
Besides our thighs.
Or we just got a thigh master that looks cutesy.
It is really cute. I love the colors.
So hers got it like this.
Yeah, you're definitely probably going to get Meg the Stallion legs.
Right?
Okay,
and we squeeze.
Yeah, exactly.
Wait, hold on. I'm squeezing. I have to do something because I'm just right now concentrating on my thighs. So I should be concentrating on squeezing something.
So, okay, if you were to use this, first of all, I've
never seen it before.
No, it's like a new modern age Thigh Master.
Okay,
The older one was harder.
Your inner thighs play a big role in controlling it. I do. I don't know why I didn't think to wear.
I know.
One day I'm gonna wear it.
Next time.
But
part 2.
honestly, like the movement that it does definitely helps support pelvic floor.
Okay.
In that your inner thigh muscles can play a big role in controlling those muscles. And a lot of people compensate.
They're connected.
Yes.
So,
let me show you.
And this might help my tailbone on top of that too, because my legs are probably weak.
No, I don't think it will help.
No, not at all.
It'll be the opposite.
It'll
probably worse than it.
She could do it laying down.
Hey,
I didn't do it laying down.
Let me figure out different techniques here.
No, but like the inner thigh muscles like attach here, and pelvic floor muscles attach here. Okay. So what you're pulling
is this the behind?
This is
the front.
This is the anus. This is the vagina.
Oh, that's what I was thinking. Okay.
Yeah.
Okay.
And then the
because
that's
you have it like this.
Behind,
No, you're showing from down.
From front. Like if
if you're looking straight ahead. Okay,
so and then your inner thigh muscles would attach right here.
Got it.
What I honestly find, what I find with my patients is a lot more people have tight inner thigh muscles than they do weak inner thigh muscles.
Okay.
Because think about it, like most women are crossing their legs all day. So they're turning on those muscles all the time. People clench their butt, which also turns on those muscles all the time. So is this a good one if we were like, yes, we definitely have pelvic floor weakness. I just had a baby. My muscles don't do the thing anymore. And I didn't have an underlying issue before.
Amazon, you're getting a return.
I don't think it's going to help with your tailbone right.
I'm just going to have killer inner thigh muscles.
Unless she finds another way to use it.
Stretch your inner thigh muscles. I think that would be really helpful.
So squatting would probably be...
Squatting is good to strengthen pelvic floor.
Like a Kegel while you're squatting?
Yeah. Or exhale while squatting, pull those muscles up.
Okay, but who are we helping? Like, are we helping ourselves with that? Or are we helping the guy during sex because it's becoming now more enjoyable with the things we can do?
Ah, that's a good question.
Because I could live life without it unless I needed to really hold on to my pee.
Yeah.
Okay, right?
Yeah.
But like, because you just said we both have pelvic areas that we could be working on, men and women. But when we do these things, what benefit is it giving us other than what we just said, where possibly you have leakage or something like that?
So one of the things I notice is that a lot of time, why pelvic floor matters now and why doing the things to make your pelvic floor better now is because as we get older, we're losing estrogen. Estrogen then changes how we are, like the thinness of our vulva. The lips get thinner. There's more dryness. Those muscles, the power in those muscles might change because our exercise and activity, our joints are not as powerful as they used to be. So as a result, what I always think about is that 85-year-old woman that is now transitioning to a nursing home that had leaks whenever she was in her 30s and 40s, but was just living life and was like, I've got my Depends or whatever, and I'm good.
It's gonna be me.
Right. And then they get to the point where now getting to the bathroom is so difficult and they fall and break their hip.
Gotcha.
And now that hip muscle that they've never addressed doesn't even have the power to help them. And now they're leaking and need to be assisted to change, or they're soiling themselves and getting bed wounds.
So I think I got this. So basically, it's like any other part of your body that you would work out that would help you for preventative joint, anything like that.
Yeah.
This is going to help you for the future where you have better control.
Exactly.
You're able to use it better and you need to do this in the gym on top of all the other workouts.
Yeah. And you can poop better.
Yeah.
And you can pee better.
Yes.
Because who taught you to poop?
Yeah.
Nobody.
Right.
We don't really need lessons
and
on
they
pooping.
don't really, but they don't explain to us how you need to break it up.
Exactly.
You know what I mean? Like when you're not doing anything, you're not moving, you're not drinking, and you're not, it's like you're constipated.
How about for like sex like with my husband, you think it'll
or not your husband?
Stronger? No, not only my husband. Will it have like stronger orgasms or all of that stuff?
It will help with your orgasms.
Yeah.
It will, because these muscles right here are the muscles that move up during an orgasm.
And will it help you with your orgasm?
Yes.
It doesn't actually help
No,
him
I'm talking
with
about
his
ours.
orgasm.
Okay,
Yeah.
And honestly, most women, only like 18, I don't remember, don't quote me on this, but I believe it's 18% of women actually have penis and vagina orgasms. Most people have clitoral stimulation with their orgasms.
Yeah.
So all that inside stuff is not really like, there's most people are like, no, I get an orgasm because there's rubbing action happening on my clitoris.
Right. Because of that.
Because the clitoris is being stimulated and that's what's causing the orgasm in some cases, not being tapped on your cervix over and over again.
And, and that takes us back to when we were younger, when we were like, oh, the size matters. Well, if you don't know any better, it's not really, because technically, if you're not orgasming,
it's a taboo.
Yeah, if you're not having an orgasm from the inside and it's only the outside,
you could still get
Listen, guys, it's a new world.
Just saying.
Yes.
Just saying, you got to pay attention to the outside, too.
Well, we would love to have you and continue this. Yeah. I mean, I've learned something today. So,
but we need to play a game, though.
Yes. Yeah.
We're playing a game with you.
Yes. So we wanted to do a little game with you, and it's called, hold on. My mind went blank because talking about all this other stuff.
We had to pull it up.
Clench it or quench. Clench or quench
is going to be what you're going to answer to the question.
Okay. Yes. Quench meaning.
So read her what it means.
So clench if a scenario calls for engaging the pelvic floor.
Okay.
Quench if it's a moment to chill and release.
Ooh, okay. Got it.
Right.
Hydration, rest,
hydrate your pelvic. Yes. I love it.
Yes.
I love it.
Right.
Okay.
Right. The first one.
All right.
Jumping on a trampoline.
Clench.
Mm-hmm. Got it. I'll do the second one. Netflix and wine night.
Ooh, quench.
Mm-hmm.
Laughing at a comedy show.
Clench.
I'm going to make sure I'm sitting down if I do go to a
Suck in the straw and clench.
Right?
Peeing just in case before you leave the house.
I have a real feeling about that. That's a no-go for me.
But is it quench or is it clench?
Clench.
Quench. So it's more for relaxation and feeling like
peeing?
Yeah, like relievement.
Which one? To pee before you go?
To go ahead and pee before you leave.
Okay, so the reason why I say clench is clench is because I don't think you should go just in case.
Okay.
You're poorly training your bladder and making it boss.
Well, that would make sense.
True.
But the normal person would think it's a relaxation, a relievement.
Exactly.
Yes.
Yeah.
Exactly. Deadlifting at the gym.
Clench.
For sure.
Yeah.
Yelling at your kids in Target.
Clench.
It says quench.
I know. But maybe clench
But it says
your patience. Maybe clench your patience.
Clench your patience.
Clench your patience, but quench your pelvic floor.
Yes.
Here's one for me. Coughing in public during allergy season.
Clench.
For sure.
Sitting on the couch for 4 hours.
Quench.
Quench it is.
Yes.
And then bonus round, pelvic myth busters.
Okay.
So rapid fire myths, and the guests, you're going to bust them on the spot. So you're going to say myth or not. Okay. So let's see. One is you should do Kegels all the time.
Wrong. Don't.
Okay. Myth.
Yeah, myth.
Pelvic pain is just part of getting older.
No, it can get better. That's a myth.
Only moms need pelvic therapy.
Myth.
Leaking a little is normal after birth.
Ooh.
It's like a yes and no.
Until 3 months.
Until 3 months?
Yeah.
Okay. All right.
Got
so
it.
after that.
That's common.
So like 10 years, 13. Wait, how old is my youngest? 14 years later? That's not.
That needs to be addressed.
I'm going to have to go.
Thing for her though.
All right.
Okay. So I have a question for you because we have this as a conversation starter cards or whatever. What did you want to be when you were younger?
A backup dancer.
You did.
A backup dancer.
Okay.
Nothing to do with what she's doing now. So for
Maybe.
who?
That's why I said maybe.
Oh, funny story. Once I did dance backup for Chris Brown once
Ooh,
in college,
really?
but he was really young at the time. But I
it's
danced.
still Chris Brown.
Yeah.
Still counts.
But I think maybe Missy Elliott.
Ooh.
Okay.
Oh, yeah, that would be fun.
Yeah,
That was back in the
they were
day.
like
Mhm.
high. Missy
Yes.
Super duper flat.
Yes.
Okay, so if you could go back, I mean, well, now knowing what you know now and who you are now, would you still want to be that backup dancer?
No, this is so much.
But you
more
want to
Pelvic
do
all
what
the
you're
way?
doing now?
all the way.
Yes.
Okay.
I love
Well,
what I do.
Awesome.
Cheers. We
Cheers.
had a blast with
Oh,
you. I think we
thank
definitely
you for
got
having me.
Yes, we definitely got to come back and talk about this again.
For
Yes.
sure.
Ladies, put the questions in the comments. If you have anything you want to know, we'll get it for you.
Yeah.
Until next time.
Cheers.
Cheers.
Cheers.